All right, recording's going. That's my cue to get started. Thank you, everybody, for being here for our Time to Act Mental Health Echo. Appreciate you taking the time to be with us today. Janelle Preston, who usually facilitates this, is off enjoying herself with her kids over in Europe this week. So we gave her the time off, even though it is only 7 or 8 o'clock over there. She could do this, but we'll let her off. So my name's Kurt Phillips. I work with Janelle and Shayna on the Project Echo, along with our wonderful hub members. Just really quick, would remind the hub members to go ahead and put their name, their chat with an asterisk or two in front of it. As a reminder, we record these echo sessions for future use for anyone who would like to use them. By participating in this echo session, you're consenting to be recorded. So if you don't want to be recorded, just go ahead and ask you to discontinue this meeting right now for yourself. We know that Echo is an interactive community that with presenters, case studies, and community members, we're all trying to just learn from each other and share information. We'd encourage you to be interactive as you go through this session. If you have questions for Cathy or any of the other presenters, please go ahead and throw it into chat. You can raise your hand if Cathy sees it. She'll go ahead and respond as appropriate. We will have other questions and answers at the end of the session too. So if you have questions that aren't pertinent to the exact topic right at that time, go ahead and save that till the end, and Cathy will have some time for questions and answers. We also, after the didactic session, we do have a case narrative that we will talk about and help one of our participants be able to gather some information about how to handle certain situations. Always remember that we are always seeking case narratives. Case narratives are a wonderful way to get information and answers to questions you have. I just had one on one of our other echo sessions just last week. Got a lot of great information and suggestions on how to help a family I work with. So please always feel free to do that. If you're nervous or you don't like presenting or being in front of people on a camera, you can always send that information to us. We'll gather whatever information we need, and we as an Echo team can present that case narrative for you or the case presentation. And that way you can still get the information without having to put yourself right out there on the screen. We do ask you that if you do have questions or if you're presenting and have topics about specific people, please make sure we keep that confidential. Don't use first, middle, or last names. Also, don't identify other identifiable information. We want to make sure that we keep privacy a key. If you don't know if something would be too confidential or not, you can always reach out to a hub member. They're the ones with the asterisk in front of their name. So as I mentioned, the key components of the Echo session, we have a didactic speaker. Today, that's Cathy Bledsoe from Hope for Utah. I'll let her introduce herself in a minute. We do have the case presentation. And then also one of the great parts of Echo is that professional networking. We've talked as an Echo Hub about ways that we can best connect. Encourage you to put your name and your contact information in the chat. If someone makes a comment or someone that you want to get a hold of, please go ahead and look through the chat and see if you can see who that person is. Gather their information so we can continue to build these professional networks and be able to continue to find ways to interact with each other on a professional basis around these topics. Hopefully you all know how to name your profile. If not, there are ways right here on the screen to be able to do that. We'd ask you again to put into the chat your name, contact information, and email or whatever you want to use, and then where you're from, just like the example at the bottom, John Smith from Utah, EDI Advantage, and then John could put the email in if you'd like to have that out there for people to contact him. Keeping in mind, there's the raise your hand feature that's down toward the bottom of the screen. If you don't know how to do that, you can always message someone with the asterisk in front of their name and we'll help you get that hand raised. Or you can just put your question into the chat and we'll address it there. Shane and I will be monitoring that chat throughout the course of this presentation. If you want to get credit for this, for your attendance at this session, we need you to fill out the evaluation. Shayna will regularly put that into the chat. You can just click on the link and go ahead and fill out that survey. The surveys are critical for us to be able to get continued funding so we can continue to bring these Echo sessions to you free of charge. If you have the opportunity to fill that out, we'd sure appreciate it. We do send out a certificate of completion for the session for all those who complete the survey. While we don't offer continuing education hours specifically, you can always take those certificates to your professional organization if you'd like to be able to get credit for those. We do use Canvas, the learning platform that we use. all of the information shared today will be in there. And I believe, Cathy, you'll probably allow us to use those slides that you present, and we'll go ahead and put those in Canvas, as well as other pertinent information. I know Cathy's asked about us sharing with you a conference that's coming up, so we'll put that in the Canvas as well as likely in the chat today. But the Canvas is where we put a lot of the information. You can connect with other people on the Canvas. The recordings are there. There is also a discussion board. If you have questions or want to discuss, you can use that feature in the Canvas. To get on Canvas, you do have to register for these sessions, and then we send you an invite for the Canvas page. Again, case studies, we love to hear from people about the struggles or the challenges that they're having, and we like to take everyone on these calls and allow them to give input. So following the didactic presentation, we will have the case presentation, and in breakout rooms, we'll discuss the topic on that case presentation. If you are interested in sharing a case, whether or not you want to be the one that actually shares it or not, please reach out at, well, this says earlyecho@aggies.usu. Is that the accurate one, Shana, or is there a different email for this one? I believe
this one's the time to act. I'll drop that in the chat.
Okay, so this is, sorry, we got the wrong slide deck. They're all the same. They just have this little difference between the two of them. So Shane will put in the chat the email for the time to act echo. Go ahead and send it to that if you have a case study or want to, or even interested in knowing more about those case studies. Here is our social media presence. We'd ask you to follow us on any of these social medias so that we can give you information. You can be connected with us, and then ask you also to share with friends this opportunity to connect, especially around topics on mental health. And with that being said, I believe I'm done talking, so I'll be quiet. I'm going to stop sharing. I'm going to turn the time to Cathy Bledsoe. She's from Hope for Utah. I'll allow her to introduce herself a little bit, but we appreciate her taking her time on this super important topic of suicide prevention. So Cathy, time's yours.
Thank you, Kurt, and appreciate the opportunity to share our story about Hope for Utah and our Hope Squad program. I'm going to go ahead and share my screen. Okay, let me get started. So my name is Cathy Bledsoe, and I'm the Assistant Director with Hope for Utah. I've been involved with the program since Greg Hudnall and I started working on suicide prevention way back in 1999. And we both worked in Provo School District. I was a prevention specialist. Greg was at the time a student service director and became associate superintendent. And we were losing students to suicide. And came up with some ideas that I'm going to talk about, how we organized our community, came up with an idea of Circles for Hope community suicide prevention model, and eventually we organized a Hope Squad program. So to begin with, ABC contacted Hope Squad. This has been several years ago, right after COVID. And this is the Surgeon General was talking about the importance of peer-to-peer.
What are some answers to address that?
We need to train psychologists and therapists, and we have to think about how we train families as well, including parents, and how to identify concerning symptoms. We need to support peer support programs, which are also an important part of supporting kids.
Show of hands, if you know someone that at some point has self-harmed.
Filling that gap here in Mason, Ohio, the Hope Squad.
Tons of people needed help during the pandemic.
It's our job to watch out for our peers and direct them to the help that they need.
Today, they are role-playing on how to handle self-harming behavior when they spot it.
I just get really angry.
I'm here to listen. Like, I'm here. Or we can both go to a counselor.
What we're finding is so many of our kids want to help. They hear more so than us through social media and texting and in ways that as teachers, we don't see that.
Oops. Okay, I'm going to move on. That gives you the gist of that story. And research has shown that mental illness can begin as young as age 14, that the signs of mental illness start to emerge around puberty. And so the need for mental health programs with our youth is very important. Every year or every other year, we do the SHARP survey. I think maybe many of you have heard of it in Utah. That I used to facilitate that survey in Provo School District. There's two parts to it: prevention needs assessment survey, and then the behavioral risk assessment. And we've known from this survey that suicide has become a major concern among our young people, and mental illness, mental health has become a concern. So as I mentioned, Greg and I started working on suicide prevention back in 1999. And back then, I didn't have this handy laptop. We didn't have, all I had was my pad of paper and a pen. And Greg went to the whiteboard and started writing down, we're going to do this, we're going to do this. And so on that list was organizing a task force, which we did. We organized the Utah County Hope Task Force, which still meets today. We started a statewide conference in the year 2000. This is going to be, I think it's our 23rd year. We missed a couple of years during COVID. And so we brought our community together and created this idea of a Circles for Hope model, where you bring together community agencies, mental health, and schools, and collaborate together on how to provide the best services for your kids in the school and for their families. And so this video illustrates our Circles for Hope model.
We are living in a time when suicide is a chronic and an escalating concern. Recent studies have revealed that not only has suicide become one of the leading causes of injury death in America, but also one of the leading causes of death for people between the ages of 15 and 49, surpassing even cancer. Can most suicides be prevented? The answer is yes. Individuals who are contemplating suicide frequently give warning signs of their distress. Circles for Hope uses a comprehensive, holistic, and grassroots approach to community suicide prevention, intervention, and postvention. An African proverb says, "It takes an entire village to raise a child." Hope Squad believes it takes an entire community to save one. Circles for Hope builds community connections by training adults to take an active role in suicide prevention. Community trainings are provided to understand warning signs and who is at risk, how to intervene, and where to go for help. Circles for Hope also creates essential partnerships with the local mental health agency, as irreplaceable resources are provided throughout the community. They are a critical part of a community crisis team, as people from all agencies work together and share information for the public good. Circles for Hope offers school programs and training for staff in suicide prevention, intervention, and postvention. Successful suicide prevention begins with education, and prevention is where the greatest energy should be focused. The goal is to train all school personnel to recognize warning signs, identify someone who needs help, where to access the help, and when to notify family. The schools also implement a peer-to-peer Hope Squad program, where students are nominated to become trained in suicide prevention. The impact of suicide is far-reaching and affects entire communities. When communities, mental health organizations, and schools work together to prevent suicide, the entire community is strengthened. Working together, there's hope that suicide can be prevented. For more information on suicide prevention, intervention, and postvention, visit hopesquad.com.
I'll just say visit hopeforutah.com. But what we found with bringing the community agencies together and then the mental health agencies all to the same table is that it opened the doors to the schools. And so what we do is we encourage our schools that when they have an event, maybe it's parent-teacher conference or a mental health fair, that they invite that local mental health agency into the school to be able to share those community resources with the parents in the school. So we feel that's a vital step in preventing suicide, increasing mental health among our youth, is helping to increase that awareness of where parents may get help, and then to provide that access for services for students that struggle. So what we found is that if you can create a common language where people understand warning signs, they understand who's at risk, a common understanding of how to intervene, and a common knowledge of where to get help, you can have good suicide prevention in your community. So what happened in Provo? We spent a few years organizing the task force, presenting to our mayor, our city council. We became trained in QPR. We started doing faith-based presentations on Sunday. We just presented to anybody we could about mental health and presenting suicide and increasing that awareness. But we were still losing students to suicide. And in fact, in 2001, we even lost a fourth grader, which was very devastating to us. And so Greg said, you know, we need a peer program. And so we organized a committee of our school counselors, our school social workers. We had some of our mental health partners, our school psychologists, and this group spent a year looking at programs across the country. Came up with an idea, rolled it out at Timpview High in 2000. It was like 2004, 2005 school year. So we're coming up on our 20th year with the Hope Squad. And they rolled it out at Timpview High. And the program went so well that we rolled it out in all of our schools. And this next video tells you about the Hope Squad program.
Suicide is the third leading cause of death among youth between ages 10 to 19 years old. 4,600 youth are lost to suicide each year. However, most suicides are preventable. Youth who are contemplating suicide frequently give warning signs of their distress. 7 out of 10 will tell a friend or give a warning sign that they are struggling, but many of their friends do not tell an adult. A Hope Squad is a group of students nominated by their peers as good listeners and caring fellow students. They work closely with the local mental health agency. Hope Squad students are taught by the school counselor and advisors on how to recognize suicide warning signs in their peers and provide support. Hope Squad members are trained on how to talk to a fellow struggling student. If the peer needs help, they listen and then try to convince them to go see an adult in the school. If that does not work, they inform a school counselor about their concerns about their peers, so the advisors can contact the student and the parents for additional help and support. Hope Squad members also bring suicide prevention awareness to the entire school by holding an annual Hope Week, where fellow peers are given information about suicide prevention. For more information, please visit www.hopesquad.com.
So that video gives you a good background of the program, but what happened in Provo was we were losing students, and we averaged about 1 student suicide a year, which was very, very difficult. And back then, I kept all this data. We didn't have Google Forms, we didn't have SurveyMonkey, all the electronic platforms we have now. It was all paper. And we had a form that our social workers and our school counselors would fill out when they met with a student that had suicide concerns. I collected all that data and kept these records from way back when. So we knew what we were dealing with. Well, when we started the Hope Squad program, you can see we went 9 years without losing a student to suicide. And I worked a lot with prevention, and we know that when you work with prevention and you increase awareness, reporting goes up. I think we saw it with safe and drug-free schools. When you increase awareness, reporting goes up. And that's exactly what happened, is that kids started to understand that they weren't the therapist, they weren't the counselor, and what their friend was telling them that needed to be taken to an adult. And that they didn't keep those deadly secrets, that it was more important to get that friend help. So we know friends will talk, peers will talk to peers, and nowadays they text before they even talk to an adult. So it was breaking down that stigma of help-seeking behavior, breaking down the stigma surrounding talking about mental health. So all of that has happened with our Hope Squad program. Now I have another video, NBC Nightly News, and this has been quite a few years ago because it'll say that there's 500 Hope Squads across the country and there's actually 2,000 now. But this will give you a good feel. Once again, they're in Mason, Ohio, and they visit Orem Elementary here in Utah, but they talk about what the Hope Squad kids do.
In high schools across the country, a crisis. Who here knows somebody personally who's contemplated suicide? Wow. Every single one of you. Suicide now the second leading cause of death between the ages of 10 and 18. For Utah Principal Dr. Greg Hudnall, it's more than statistics after he was called to identify the body of one of his 14-year-old students.
I literally threw up and sobbed. I made a vow that I would do everything that I could to help prevent suicide.
He founded Hope Squad, a way to help kids change how they talk about mental illness.
Those young people feel like they're the only one, that they're embarrassed, they're struggling.
The program gives students the tools to recognize those in need and get them help.
I don't think that most people understand that people do say that they're going to commit suicide most of the time before they do.
There are now more than 500 squads across 18 states and Canada. Another 100 will begin next year.
We're having this connection now, we're having this relationship now, and I care about you.
Students are chosen by their peers and specially trained, meeting regularly. This is Hope Squad's first year in Mason, Ohio, and the first year without a suicide since Abby Gadio started at the school 4 years ago.
Do you think Hope Squad has saved lives this year? For sure. I think that because of Hope Squad, we get to those students early enough.
That stigma is breaking down. Students are willing to accept help.
Fifth grader Valerie Golvar recently spoke up when she saw a friend was cutting herself.
She told me about it and said, "Don't tell anyone." And my immediate reaction was to go straight to a Hope Squad advisor or an adult.
A move that may have made all the difference for that student and her peers.
The best part about Hope Squad is just knowing that you're able to help
and hope at a time they need it most. Kristen Dahlgren, NBC News, Mason, Ohio.
Hey, NBC.
So the Hope Squad program is a school-based peer-to-peer suicide prevention program that trains and mentors students nominated by their peers to perform intentional outreach with fellow students. So these students are taught to see their other students. We have Hope Squad advisors that will tell their students to put their phones away when they're in the hallway so they can be saying hi to the other students and actually see them. So what do the Hope Squad members do? They learn about mental health, self-care. We're very heavy on self-care, boundaries, reporting concerns, reduce the stigma of mental illness, increase help-seeking behavior, and most importantly, they organize school-wide activities that promote connectedness and inclusion. So Hope Squad members watch for and refer concerns. They're not trained to be counselors or therapists. That's very heavily covered in the curriculum. Committed to self-care, organize Hope Week with school-wide activities that promote inclusion and connectedness, and promise to always report a concern. So this is a student that was at Pleasant Grove High, and he tells his story about being invited to serve on the Hope Squad.
So earlier this summer, I got a letter being nominated for Hope Squad, and this was a big honor for me. But unfortunately, I looked at my schedule and it was all filled up, and I was like, well, I guess it's too bad. I guess I just won't do it. And then later, it was before school was gonna start. I was texting a friend, and she started telling me these things that she was suicidal. And I got pretty scared. I was like, oh, I don't know what to do. I was just getting pretty nervous. And I was like, I don't know who to turn to, what to do. Luckily, later, someone was able to help her out. But what I most regret was being able to not know what to do and help her. So I decided to clear up my schedule and be able to get Hope Squad in, because I wanted to know how to be able to help people and how to be a peer advocate. So I took the class, and it has helped so much. I've been able to reach out to people more, be able to see these things in people, and be able to become friends with more people, and just reach out to those I don't even know. And then later in the school year, knowing all these things, another situation came up where someone was suicidal. And this time, luckily, I was able to help them. And nothing feels better than being able to save a life and being able to know that I was able to help and be an advocate for them.
So one thing that's come up over the years, people will say to us a couple of things. First, they'll say, is this too much pressure on kids to learn about mental health, to learn about suicide warning signs, to understand that if they see self-harming behaviors, that they need to get an adult involved? And what we've heard over and over from Hope Squad members and other students is that it's not too much pressure, because they're already talking about it. They're already discussing it through texting or whatever their communication is. And then the second thing we've heard, people will say, well, that's great what you're teaching the Hope Squad members, but what about the rest of the school? And that's where these activities come in that promote that awareness. A lot of Hope Squad members, for example, we've known of high school Hope Squad members that will go to the junior high and teach lessons about self-care or boundaries or being a good listener, or what are the resources if you're struggling. And we had a student from, I think it was Utah State University a few years ago, do a study, and I think it's almost a no-brainer that students like to listen to their peers. And so having that peer-to-peer connection and sharing this vital mental health information really goes a long ways. And I think students will take it more seriously and to heart from a peer. So our objectives are to train Hope Squads. We'll train students to recognize suicide warning signs and act upon those warning signs, to break the code of silence, build positive relationships among peers, and to facilitate acceptance for seeking help, change the school culture. And we've heard this over and over again, especially in elementary schools, when you have a group of students that model positive, friendly, non-bullying behavior, that it really can change the climate into a more caring environment where kids are watching out for each other. So this is a video by Christy Wood. She was a Hope Squad mom and shared her story.
My name is Christy Wood, and we live in Linden, Utah. 3 of my kids have been in Hope Squad, the youngest 3 since they've started doing them in this area. They started the high school one after we'd had a couple suicides, and our school was at a real low. And it has been such a positive program in our school. How they choose Hope Squad is kids, the student body will select names, turn in names to their administration, or however they do it, of kids that they would feel comfortable talking to and they would trust. You know, I was joking with Greg, the founder of Hope Squad, and he was telling him some families do baseball and some families do karate. Well, our family does Hope Squad. And it's kind of been something that I guess we started parenting in a way that my kids were kind of already on that Hope Squad path before it even existed or we were aware of it, because it's always been really important for our family that we include others. We were the family that you couldn't just invite one or, a couple of friends. You had to invite the whole class over for the event. And we always did that thing. It's more important to be kind in our family. And so I don't think it was such a stretch. And I think that I think that a lot of kids would like to be not that way, not like my kids are so awesome, but I think they would like to know how to look out for others. And that's one of the things I love about Hope Squad. Like I said, my kids, we tried to be includers, but they didn't start out with the skills on knowing how to look for a lonely person or see the signs of someone that might be feeling depressed or suicidal. They had to learn these skills. And that is one of the things that I love about Hope Squad, particularly in the high school. They have a class where they meet and they get the training that really helps them be effective. And I know that sometimes parents worry that it will get a little dark and heavy, but they really do teach them the self-care skills that they need. In fact, my senior boy, I joke sometimes the other day, he came home from school and he was like noticing like, yeah, I had kind of a hard day. He was telling, I was telling him I had kind of a hard day and this went wrong. And he was like, Mom, and he came right next to me and put his arm, I can tell you've had a little bit of a hard day. That must be a little frustrating. What can I do for you? And how can I listen and help you? And I turned around and said, you are Hope Squadding me, bro. And it was kind of a good thing because I really don't we want our children to be like that, empathetic and kind and capable that way. And so I was really thrilled that he could look out for the feelings of his mom. If he's looking out for his mom's feelings, he's looking out for others. My name is Christy Wood, and I am a proud Hope Squad mom.
Okay, so we have curriculum that I think is amazing. I have an elementary education background. We've had writers that have masters in curriculum develop, help us with our curriculum, and all of our curriculum has been reviewed by a mental health professional. So once again, it's that partnership with mental health. So in elementary school, it's 3 years, 4th, 5th, and 6th grade, and we included 4th grade because of our experience with a 4th grader. And middle school, 3 years, middle school, junior high, and high school, 4 years. And it's great social emotional learning. And it covers a wide range of topics in elementary. There's only one lesson each year that even mentions suicide. The rest is anti-bullying, resilience, mental wellness, a lot of literature. We use children's book, which that was my favorite class at BYU. And then the secondary curriculum talks more about those warning signs, what to look for. This gives you an idea of our curriculum outline for elementary and our scope and sequence of the curriculum. Junior high, middle school, you can see we have very comprehensive topics, a lot on self-care and resilience. You can see the different topics there. And our high school, we just updated our year 4, so it's not on this chart yet, but it's very comprehensive like these other 3 years. So this little video is from Orem Elementary and illustrates how an elementary Hope Squad can share what they learn.
We wanted to share what the Hope Squad kids were learning with the rest of the school. And so we tried to think of a great way to do this. Of course, we do Hope Week every year, which is a great way to share what we're learning.
Every class in the school has 2 Hope Squad members that go to visit their class every month. And we read them a book to teach them about what we learned in Hope Squad this month. Sometimes we talk about trusted adults, having hope, and talk about bullying. It also helps them learn which people are Hope Squad members.
So if we learned about talking to trusted adults, they'll go to their assigned class, read a book that we read in Hope Squad or one of the other books, and talk to the kids about telling trusted adults. And they do adjust to grades because we do kindergarten through 6th grades.
We go to a 1st grade class and a 5th and 6th grade class. It's fun because you can tell the kids stories and you just skip out of class and you get to see all the kids smile.
And a lot of great things happen. The kids get to know these Hope Squad kids really well. So at least they know 2 or 3 of them really well. Could go talk to them if they need to. And they're learning a little bit about what we're learning in our Hope Squad lessons. And it's really easy to set up. The Hope Squad kids are in charge of setting up their time with the other teacher and with their own teachers. So the advisors really don't have to do that much.
Say no to bad things.
It's okay to come from a different place. It's okay to be embarrassed.
It's okay to come and last. It's okay to dance by yourself.
It's okay to have a pet mom. It's okay to be proud of yourself.
It's okay to have different moms. It's okay to have different dads. It's okay to be adopted.
It's okay to have an invisible fun. It's okay to do something nice for someone.
It's okay to lose your mittens. It's okay to get mad.
It's okay to do something nice for yourself. It's okay to help schools collect nuts.
It's okay to have different kinds of friends. It's okay to make a wish.
It's okay to be different. You are special and important just because you're being who you are.
We just found that this has been a really wonderful way to involve everyone in the school in what we're learning, and it has really changed the climate of our school. We have a climate of students who look out for each other, and it's just been wonderful.
Is it okay to have different friends?
Yeah.
Okay, that's a really fun video. So one thing about the program is we encourage these students to get involved in the community events, get their schools involved. And those of you that are in Weber County may be aware of the Light of Hope, and a couple of people climb up to the top of a mountain and shine this bright light. And people turn off their house lights and kind of get together and look at the beacon of light. And so these are community events that Hope Squads will partner with and promote in their schools and with their students and the parents within their community. And our governor, this is when he was lieutenant governor, and he shares his story.
Hi, I'm Lieutenant Governor Spencer Cox. I was born and raised in the small town of Fairview, and I'm raising my 4 kids there on the farm that my great-great-great-grandfather settled over 160 years ago. I went to North Sanpete High School, and unfortunately, when I went there, we didn't have Hope Squads. I've talked about this before. I struggled with suicidal thoughts when I was young, and fortunately, I was surrounded by some really good people who helped me through those very dark times. We've looked at the research and we know that Hope Squads and peer-to-peer groups in our high schools are incredibly important to help reduce suicide in our schools. I am so excited to have Hope Squads now at North Sanpete High School. And my own son, Caleb, has been able to serve on the Hope Squad for several years. It's amazing to watch as these kids reach out to their peers to help those who are struggling, to help their friends and students know that there is a place with people who care about them, where they can feel acceptance, where they can feel loved, where they can find someone to talk to, where we have students looking out for others who may be marginalized, who may be suffering, and who may be thinking of ending their own lives. We need more Hope Squads. We need more students on Hope Squads. I'm so excited to see, I've been able to travel the state and talk to Hope Squads all over the state and see the incredible things that they are doing to help prevent suicide in our schools. I am Lieutenant Governor Spencer Cox, and I am a proud Hope Squad dad.
Okay, some other things that Hope Squad kids will do in their schools. This is from Oklahoma. And as was mentioned, they do Hope Week. We encourage them to do Hope Week, where they do activities every day for a week and really focus on local resources. They can do lots of fun things within the school, and the kids just come up with lots of creative ways to share hope, to promote inclusion and connectedness, which is so important in a school. So that concludes my presentation. Questions for me?
Cathy, I have a question for you. Talking about Hope Squad, it sounds like it's a nationwide program now. Started here in Utah, though.
Yet it did. And now in Utah, I fall, even though I helped get both organizations going, Hope for Utah and the Hope Squad program, Hope for Utah is the nonprofit in Utah that oversees and runs the Hope Squad program. And outside of Utah, Hope Squad is for profit. And with the program is the same, but some of the business part of it is very different. In Utah, Hope for Utah, one of our main objectives is to go anywhere, train anybody, any organization in QPR. And we also have a faith-based training, and we don't charge to do that. So that's one thing we feel that, once again, that Circles for Hope model, the more that you can raise awareness, the better mental health, the better suicide prevention a community will have.
So I'm just Googling Hope Squad and it pulls up a website. Is that, so if we had family or friends that were in Iowa or Texas, could they Google search Hope Squad Texas, Hope Squad Iowa, and it would pop something up that's a similar program to what you're discussing here, but it's just based, so it's not centralized Utah and you administrate the whole nation. It's
right.
Started here and other states have adopted.
So there is a central, like, Hope Squad corporate, and it used to be in Utah that Greg and I ran the program, but we've gotten so big that and Greg is in the process of serving a church mission, that he turned over Hope Squad outside of Utah to a son. And so outside of Utah, yes, you can go to hopesquad.com. In Utah, if you're interested in the program, you just email me, Cathy, and I can put that in the chat. Cathy at hopeforutah.com, and we can help a school. And if you wanted training, we can also help that. So there's, Lisa says, how do we get Hope Squads into schools that may not have them? There's steps to doing that. Once again, you email me. I always tell people, first thing is to have your principal approval. We never want to start a program in a school without the principal approval. And then the second step is to choose who's going to run the program. Who are the adults that will run the program? And we call them advisors, Hope Squad advisors. And then those advisors need to be trained. And we do a training where they learn all the ins and outs of how to run a Hope Squad. We also do conferences throughout the state. Last year, I did 7 conferences for Hope Squad members from St. George up to Weber, Ogden area. And these are like leadership conferences. And so we do those. We don't charge for the schools and the students to come. And at, trying to remember which high school it was in Weber School District, but we had almost 900 elementary students come to this Hope Squad conference. It was crazy, really fun, a lot of energy. But there's a lot we do to help support these schools. And Greg and I had a lot of postvention experience, training, and we'll help schools that have a suicide death or even a sudden death, accidental death, and we'll help them through that process. And so my main purpose is to help Hope Squad advisors be successful in running the program. And then my second responsibility is to provide training, mental health awareness throughout Utah as much as we can.
Any other questions that anyone has? Go ahead, Heather.
Cathy, you mentioned that you do these conferences and trainings. Are those just initial, or do you do follow-up trainings as well? Kind of like, keeping the adults and those who are involved up to date, refreshers, that kind of a thing, so that they're continually feeling like they're on par and they have what they need as far as supports go, or if they run into any troubles or questions or things like that, that they they have that kind of connectedness to feel like they've got what they need to be successful.
That's a really good question. And yes, we send out monthly newsletters. We provide, if you go to hopeforutah.com and click on, we're just updating the website, so I'm not sure if it's totally updated yet, but under resources or parent tab, we send out these monthly mental health newsletters to our advisors to share with the school community. You'll also see family mental health lessons on hopeforutah.com. So we have the monthly newsletter, and I'm always in contact with advisors about the latest training, the latest training modules or updates, and advisors know they can contact me almost 24/7, as long as my email's working, and we'll get help right away. But yes, we're not a one and done. We're there to serve. And Greg and I, that was our kind of like our mantra at Provo School District, is that we were there to serve the kids and families in our district. And we still have that feeling of serving kids and families throughout the state and doing what we can to help them get the help they need when they're struggling.
Quick question for you, Cathy. If you have a chance, I looked at your site for Hope for Utah. It lists the Rocky Mountain Suicide Prevention Conference, but it has the most recent one is listed as December 2023. So I didn't know if you had a link you'd mentioned about a conference. If you've got a link to that and you want to drop it in the chat, then anyone on here can grab it. We'll also, because this is recorded, we'll have that for records to put into our Canvas page. So I think those conferences are valuable to get together with people who have similar concerns and similar thought processes and want to prevent, suicide and that. And so if you do have that link and you want to put that in the chat, that would be wonderful.
And I don't have a link. I've got a flyer, but I haven't got it linked yet.
Okay.
And it's a 2-day conference. We've traditionally held it in December. And this year, Scott Poland, who is a renowned suicide prevention, oh my gosh, how do we describe Scott Poland? He was a part of a crisis response team for the United States called NOVA. And so he has extensive postvention experience, and he was going to be our keynote on the first day, now the second day. So we're working on getting those keynotes in place. And then we just have a myriad of breakout sessions. We include a hot lunch, continental breakfast. And so if I'll send that flyer, and then you can always email me for more information, and then we'll create a QR code that you can get your name added to an email list.
Perfect. Why don't you go ahead and just keep my email or Janelle's email or Shana, any of us. And once you have that flyer solidified, go ahead and just send it to us and we'll throw it in that canvas.
Okay.
We'll also put it on our social media so that we have access to that for anybody that's following us on social media.
So Emily asked, do you have resources for parents or other family members that want more information about the content? And yes, so we have a parent manual in English and Spanish that has been created for the Hope Squad parents that gives help information, like how do I talk to my child about bullying? How do I talk to my child about suicide? But then there's also a snapshot of each lesson. And that snapshot will contain like family questions you can talk about, activities to do at home. And one thing too in the curriculum that is just one step further is that at the end of each lesson, it's connections to school, connections to family. And so it's how can this information be shared with the rest of the school? How can it be shared with the family? Just like that Circles for Hope model early on, the family is so important, and strengthening that family and those skills will just help those kiddos as they come to school. And so once again, on hopeforutah.com, there are family mental health lessons that are for anybody There are the monthly mental health newsletters in English and Spanish, and the family mental health lessons are also in English and Spanish. So yes, as far as our research, we've been on Utah's list for a number of years, and the National Evidence-Based Committee was disbanded years ago, I think before COVID, and they just now came back, and we received an email last year or notification from SPROC, the Suicide Prevention Resource Center, and they were opening for applications to become evidence-based and listed on their list of best practices program. So we put all of our research together. They went through our curriculum. And so, yes, we're on SPROC's list now. So you'll see that as we're updating our website, we are on that list, and are also, there are other lists out there. I think Blueprints might be one with the Communities That Care program, but we're looking at getting on those other evidence-based lists.
Awesome. Any other questions anybody has before we move over to the case presentation? If not, Cathy, thank you so much.
Yeah.
You're welcome to stick around for the case presentation. You're welcome to go whatever you prefer. We're going to break into breakout groups here in just a second. Introduce Heather Mitchell, who will be doing our case presentation today. I've known Heather for a lot of years. She's a pretty decent person. So I'm glad that you're all here for this case presentation. I'm going to go ahead and share my screen, I think. I can figure this out. And then Heather will just let you have the time to go ahead and let's see. Are you seeing that?
I
Echo, Heather?
am.
Okay,
Thank you.
perfect. You just give me the cue when you want me to forward the slide.
All right, go for it.
All right, trial number one. There we go.
There we go, click. All right, today for case study, presenting a family of 5, mom and dad, 3 children. Oldest daughter is 15, son who's 12, and then youngest is a 10-year-old daughter. For this family, the oldest daughter was diagnosed with social anxiety. She did receive mental health therapy when that diagnosis was made, but with the progression of that therapy and improvement, it was determined that that therapy could end, and so it did. And then during the time of that therapy, however, she did develop some tics, both motor and vocal tics, and was referred to a nurse practitioner for medication, and received medication management for anxiety and tics. Those tics continued and lasted for about 2 years, and so she did end up going to primary care physician and was referred to Primary Children's Medical Center. About 4 months, for about 4 months, she has been experiencing panic attacks that occurred. This is a new thing. These panic attacks started about the beginning of the school year. They seemed to start triggering when she started doing her phys ed classes. And rather than triggering with anxiety, they seemed to be triggering whenever she started doing the cardio in her classes. So increasing heart rate, breathing, that kind of a thing, which was part of the reason she went in to see her primary care. So the combination of those tics and these panic attacks elicited that referral. Her nurse practitioner has been working on her medications to try and alleviate those symptoms, but it did not come without some difficult side effects for those medications. Over the Christmas break, she decided that she was going to skip some of her medication doses because she felt like they were unnecessary. She wasn't in school at the time, wasn't having the panic attacks, that kind of a thing, and didn't want to experience the side effects. A couple of days prior to returning to school, She had a severe anxiety episode and she attempted to end her life. Go ahead and change. Back one. Sorry, go ahead. My bad, you can skip back. So the main goal for this family is access to mental health resources during a crisis, during this attempted suicide experience, and then navigating resources in mental health for this family. And then the next slide. Their goals were obviously, a big concern was immediate mental health support for their daughter, preferably a therapist who was a good fit. There's a concern about her disability needs, not only the anxiety, but then there is a suspicion that she has Tourette syndrome. She didn't feel like she had a successful experience previously in therapy, so that's obviously a concern for her as the patient or as the one going into therapy. And then also the family, those mental health needs. Both of the parents work full-time, and they have those 2 other kiddos who are feeling the impact of this suicide attempt, as well as their sister's escalating health needs. The barriers that this family are facing, the parents who have now taken their daughter to the ER for this suicide attempt, have followed all the recommendations that they were given, including the referrals for mental health resources, without feeling like they had any success. The referrals they were given for therapists were not available. Mom attempted to contact multiple therapists and agencies. Many were unsuccessful. When she finally did have success, she was told that the soonest they could get her daughter in, even with a suicide attempt, was 6 weeks. So they did proceed with that. And then after a couple of months, her daughter said that she wasn't sure that this was going to be a good fit. She didn't feel like it was really helping. The parents are concerned about starting over. What will this mean for their daughter? They're concerned about her well-being, the timeline for finding another therapist. What about her disability needs? By now, they've started with their visits to primary children. So scheduling concerns, trying to make all of this mesh together. All of those things are becoming an issue for this family. Go ahead and go to the next slide, Kurt. One of the big things that's come up for this family is mom's a professional working with families and has experience securing supports for them as a service coordinator. And it was a big surprise for mom in this experience, as a personal crisis for her and her family, that this was such a difficult thing to do, to meet her own daughter's needs. One of the most difficult things was realizing how hard it was to transition from emergency care in mental health to meeting her long-term needs. There was a really big gap in being able to meet those needs. And it placed a lot of stress on their family. So for this family, the big concerns are meeting those mental health resources, both in the crisis. Once they left the hospital, they kind of felt at a loss, and then transitioning to long-term needs. And then how do they have that conversation about her suicide attempt, or if her suicide attempt had actually caused her death? How do they have that conversation with their other children or their immediate family members? And then those outside of their family, that was a very difficult thing to do. It was difficult for their daughter to do. And then helping their family navigate the impacts of that, as well as what do they do if that therapy they do finally secure isn't a good fit, and is it okay to start again?
Okay, Heather, thank you for sharing that. I'm going to just leave this up on the screen for a minute while we ask any clarifying questions before we move into breakout groups. I'll let Shayna do the breakout group thing. But are there any clarifying questions that, I don't know how much Heather could answer, but any clarifying questions you'd like to ask Heather?
Yeah, I've got one.
Yeah.
All right. Did they hospitalize her or just see her in the ER and send her home?
They just saw her in the ER, and then she did meet with a social worker, and then they released her.
Question. Thank you, Nancy. Any other questions that anyone has for Heather before we move into the breakout groups?
Could you remind me how old she is?
She was
15.
15.
Pardon?
15.
15. Okay, thanks.
Mhm.